If you've got sciatica, should you be stretching it, or is this going to make the whole issue an awful lot worse? Well, recently we had one of the members ask us about a particular circumstance where their practitioner, a physiotherapist, had suggested that you should not do a hamstring stretch if you're struggling with sciatica, but instead they should go about doing sciatic flossing. And some of you might already be scratching your head because this is a rather peculiar statement to say the least. So we thought it'd be a good idea to cover this topic for all of you so that you can get a better understanding, if you're struggling with sciatica, of what you can actually do to get some relief from that pain and fix the problem for good. Like with any problem that we face, identifying the actual root cause is vital. And like we've said, with sciatica, it is not the root cause, as painful as that can be. And it's vital. If you believe sciatica to be the problem, it puts you in a very difficult position, because you're going to really struggle to meaningfully affect the outcome. This is akin to thinking that the smoke attached to the fire is the problem. You might be tempted to throw water on the smoke to try and fan it away or something like that, but this only serves to provide temporary relief at best. All the while, over there in the corner, the fire rages on, and it's the same with sciatica. Too many people get stuck fighting the fires of the symptom of sciatica rather than focus on the actual cause, the thing that is irritating that nerve root in the first instance, in the lower lumbar spine, most commonly at L4-5 and L5-S1. It is this region down here, the bottom part of the spine, which is where the injuries at that root cause are originating from. So what about stretching for sciatica, period? Well, when it comes to stretching for sciatica, the biggest issue is that while stretching might provide some momentary benefit, when done correctly with a neutral spine, it frequently is not done in a strategic manner, meaning that all the stretching itself is doing is providing some relief and forsaking the back, the injury. It's making the underlying problem worse and preventing us getting better. If we take the example of stretching for the hamstrings, these can help by making the hips a little bit more mobile instantly, which eases the strain on the lower back. But it does not effectively provide any accumulating benefit. And as soon as the injury is re-aggravated again, everything tightens back up, because those signals from the lower lumbar spine go back out to those hamstrings saying, tighten, protect me. Naturally, people get frustrated because they're doing the stretches for months or even longer, feeling like they're not getting anything more than a moment's relief before the next sciatic flare-up takes them. Stretching is a tool, but it must be combined with strengthening to actually tackle the root cause of the problem. Otherwise, it continues to go unaddressed. So what about flossing for sciatica? This practice essentially is creating a hamstring stretch, but with a terribly rounded lumbar spine. The back is bent into extreme flexion. As a result, we further aggravate the root cause in that lumbar spine, those herniated or bulging discs, compressing down on the front part of those vertebrae and squashing and driving the nucleus towards the back. Often the sciatic flossing can simply feel nice because we're actually making these little holes down here larger as we bend forwards, so the nerve coming out has a little bit more space. We're just making the relative size of the area larger, creating this release valve for the inflammation that's built up down here in the lower back. This is no different to knee hugs or child's pose. At the cost of straining the tissues, we are trying to provide this momentary relief, but it just goes in circles. Ultimately, the route to fixing sciatica is to provide stability and support to protect the underlying injury, these kind of disc bulges or herniations. In doing so, we provide control of the neutral spine, protection of these tissues at the source in daily life, helping them go through a healing process effectively with much less interruption. This helps the root cause of your sciatica, the injury at the lower level of the lumbar spine, actually stabilize. And over time, you progress these kind of exercises that are stability focused to rebuild resilience in the lower back itself, protecting this area further. Now, can you do stretching ever again? Sure you can. In fact, members of the program, we encourage them to do stability exercises in combination with strategic stretching with a neutral spine. And this interplay with stability and stretching helps you recover from sciatica. But make no mistake, it is the stability exercises that are rebuilding the resilience in your lower back, lessening the likelihood of re-injury. And we should be under no illusion that the stretching is anything more than a temporary effect, especially in those early stages of the recovery process. So what about some final thoughts? While stretching can feel nice if you've got sciatica, and flossing for some is going to feel even better, all you're doing is sacrificing the root cause for some momentary relief. Instead, we need to focus on building stability and control into your spine so we can protect those injured tissues and give them the chance they need to heal. It takes time, but if you need more help with this kind of stability work and strategy, then check out the many videos that are on the YouTube channel, on the website. We've got many resources. And for those of you that just want a more coherent, structured approach, check out the full Back in Shape program. It gives you everything you need, all of the exercises, all of the strategy, all of the education to actually deal with sciatica once and for all and create a strong and robust recovery strategy that's going to get you where you need to be. If you found this video helpful, do consider giving it a thumbs up or sharing it with someone else that's been struggling with sciatica themselves. We've also got a couple of other videos that'll really help you. Number one, we've talked a lot about a neutral spine here, and the video on when to add in flexion again, because that's on the thought of everybody. When am I allowed to bend again? That's linked down below. And also the idea of exercises if we do have severe sciatica. We've linked to that one down below as well. So check out those resources and we'll see you in the next one.